So we are speaking to Dr. Michael Hart from the University of Manitoba. Could I ask you to introduce yourself?
So, as you said, I'm Dr. Michael Anthony Hart. I'm the Canada Research Chair, Indigenous Knowledges and Social Work. I'm focused on a variety of areas in doing that. Associate Professor with the Faculty of Social Work from Fish River Cree Nation, which is about almost smack dab in the middle of North America, about 2 hours north of the city of Winnipeg.
Fantastic. And so you've come to the Canadian and Australian Roundtable on Indigenous Health and Wellbeing.
Yes.
What do you think the significance of this event is?
I think it gives opportunity for people involved in service provision, academics, politicians, or people involved in the political sphere to come together and talk about, from Indigenous perspectives particularly, issues that are important to our health and well-being. I don't know how often we get to do this where we have people from both the delivery of services, delivery of research, the informing of practice through research. I don't know how many times you get to all come together to try and address what are the challenges, what are the barriers, what are the ways to go forward.
Based on the conversation this afternoon, it sounds like there is an appetite to continue having these conversations for tangible outcomes.
I think so. One of the things for Indigenous peoples internationally, for Aboriginal and Torres Strait Islanders people here, First Nations, Métis peoples in Canada, one of the things that's really important for us is that not just research or policies are out there, but the importance of how they apply in a practical sense. And so this gives us opportunity to make sure that we're doing that, make sure that what we are suggesting brings benefit to people in communities, to grassroots, to make sure that the academics, the researchers, the politicians, the bureaucrats, that we're hearing about grassroots perspectives and making sure that we're doing what we can to remove the barriers that hinders us from providing the best service we can in the community.
Yeah, one of the messages that seemed to come out loud and clear today was to actually make sure it does have benefits, is to actually make sure that it's Indigenous led.
Yes, and one of the things that we see often is that too many people that aren't from our communities, aren't from our nations, are trying to prescribe or tell us what's the best thing for us. And decades after decades we can see that what they're telling us isn't meeting our needs, isn't, in fact, is making many things worse in many areas. And so we're clearly giving the message back that if you truly want change, if you want improvement in First Nations, Métis health, Aboriginal, Torres Strait Islanders health, then you need to step back, allow us to be able to administer, to deliver, to create the knowledge, to do all of these things, and that we aren't the add-on to what other people are doing.
And one of the issues that was discussed today in relation to why Aboriginal and Torres Strait Islander peoples and other First Nation peoples aren't actually leading the way is because we're not necessarily trusted to do that, and we need to develop, the government needs to develop that trust. What are your thoughts on that?
I think that's true. I think that trust implies that there's I'm more apt to think along the lines that we already should be the ones doing it, and that asking somebody or saying somebody should trust us, I'm not sure how well that's addressing the power dynamic where the people in positions of power are the ones getting to decide whether they can trust us. I'm more concerned that no, they don't have that right to be telling us what we should be doing, and that they shouldn't be in that position to be telling us what we can or can't do in our own communities for our own people. They can't decide that they're only going to pay attention to those who are most struggling in our communities and ignore the many abilities and strengths that we have in our communities. So while I hear that piece about trust, and I recognize that there's, at some level there's trust, I'm more concerned about how somebody else continues to dictate what we can or cannot do.
And that's about, I guess, being a sovereign people. We are sovereign, therefore. Yeah.
We should be able to determine our own directions. We should be able to rely on our own elders providing us understanding about what our cultures are about. We should be able to turn to our own values and our own practices to provide us direction in the future. Indeed, we could see through research about the benefits of doing those things, that if we are able to utilize our own practices, practices based upon our own belief systems, our own value systems, our own knowledge systems, that we know we'll be better off, that our children will be better off, and that children to come will be better off.
Absolutely. So I know that you are probably a little bit tired and it's been a long day.
Yes.
So one last question, if that's
Yes.
okay. There's been a lot of conversation today about a range of things, but what would be your one key take-home message?
The key message I'm taking home, it's reinforcing the thought that we could be doing these things. Other people who perhaps mean well, need to step back a bit and it's the wrong word, need to step back so that we can continue to do the things that we know that we do well for ourselves.
Yeah, fantastic. Thank you very much, and I shall let you go.
Great, thank you.